now.
Hi, everyone. Welcome to this edition of Live with Greg. But as you can tell, I'm not Greg Olson, director of our agency, the New York State Office for the Aging. I'm Roger Noyes, the communications director for NYSOFA, and I'm filling in today for Greg for this program, which I'm really delighted that we're having today with our friends from the Home Care Association of New York State, Al Cardillo and Taylor Perry. Today's discussion is about a really, really important topic. So as you're paying attention to the information we're presenting today, I want you to just keep note of it, share it with everyone you know. We're going to talk about sepsis, and it's a very serious condition, a life-threatening condition, but a preventable one, which is why it's so important to pay attention today. So sepsis is a global public health concern affecting 1.7 Americans who are diagnosed annually. It's the body's response to infection. It can cause tissue damage, organ failure, long-term damage requiring amputation, and death if unaddressed. So it's very, very serious. And we're going to talk today because it's Sepsis Awareness Month and learn more about this condition. And we're joined again, as I said, by Al Cardillo, who is President and CEO of the Home Care Association of New York State, and Taylor Perry, who is Senior Associate for Public Health and Policy at the Home Care Association. I welcome you both to the program. Thanks for joining us today.
Roger, thank you so much, and our thanks to Greg. This is something that we've really had the privilege of working closely with the State Office for Aging on, and Greg in particular. I would say that Greg is really, among the most impassioned leaders on this subject area. And as we've spoken many times, the conversation itself is integral to saving lives, because the more people that know about this condition and the importance of following up, the greater the chance that a life will be saved and certainly that health will be improved.
Well, and I have to note too that this is something that we've heard personal stories about all the time, even though it's kind of a misunderstood topic. So thank you so much for raising that. And Taylor, welcome to the program. Happy to have you as a guest for the first time.
Thank you so much. Thanks for having us here today. Sepsis awareness is really important, so we are very happy to be here today, and thank you all for tuning in to listen.
So I want to frame the discussion a little bit on why we're talking about sepsis in particular at the New York State Office for the Aging, and add the aging lens to this. So this is a condition that affects anyone of any age. Older adults are among the most at risk. I just want to throw out a few data points. I know our guest today will go into further detail about those. But more than 70% of adult sepsis patients are 60 years of age or older. More than 1.3 million adults 45 plus are hospitalized with sepsis each year. And adults age 65 and older are 13 times more likely to be hospitalized with sepsis than people younger than 65. So really important background. I just want to also note today, we're talking about a medical topic. So if you have specific questions from the audience that are medical in nature, please consult with a practitioner. We're going to talk generally about signs and symptoms of this condition. So really keeping it at that high level, general level. So just to start off, I'll ask Al and Taylor to tell us a little bit about the Home Care Association of New York State, what you guys do, why you're interested in this issue.
Thanks, Roger. So the Home Care Association of New York State is a statewide healthcare association. We're comprised of over 300 organizations that deliver health services to individuals at home or otherwise are supporting those services. So, your county public health agency, visiting nurse association, a hospital-based organization like the Visiting Nurse Service of Albany or the VNA of the Eddy that provide services in conjunction with their hospital systems in the home, managed care programs that also support care at home. All of those are organizations affiliated with HCA. And we provide education, technical support. We work together to innovate new tools and new ability to provide services, such as in the area of sepsis. And we also work to develop policy change and improvement at the state level and at the federal level.
And we'll certainly get into some of the details further about some of your initiatives, but I want to establish that connection because it's so important. One thing to point out, and if I got this data point wrong, please correct me, 80% of sepsis cases originate in the community. And that's where you guys operate, right? That's where your system works. So that's another reason why you're interested in this issue. You're on advisory boards for all the national sepsis organizations that are focused on this issue because of that important connection in the community. So if you could just mention that, really, talk about that a little briefly.
Sure, absolutely. Actually, the newer estimates are something like 87%. And in some cases, in some states, they estimate that like as much as 95% of the sepsis cases are originating in home and community. And so that is, what's really important about that is that while sepsis deaths occur in hospitals, where really they're the number one cause of death in hospitals. They're the number one cause of readmission to hospitals, the number one expense nationally to Medicare for in hospital care. The significance is that they're by and large originating in the community. And what's really important about that message is that early detection and early recognition of sepsis by knowledgeable individuals, by clinicians, by family members is really, really very important, because that can often make the difference between a critical episode of sepsis and an ability to treat it early when it's most treatable and when the outcomes are best.
What is this saying? It's like it's hardest to treat when it's. I always forget. I know the Sepsis Alliance refers to like finding it very early in the
It's
process.
hardest.
Right.
Yeah. It's hardest to detect in the early phase when it's really most treatable, and when it's most readily detectable are generally in the advanced stages where it becomes much more difficult to treat, and when the person has already gone into shock. It's totally not uncommon for an individual as they're going into that enter respiratory failure, be placed in an induced coma, and often the results are not very positive at the far end of that. There are amputations associated with sepsis, loss of organ and organ function, and so on. So awareness and early detection is what's most critical. In our particular case, Roger talked about the community. The population that is frequently served by home health care are in that 70% that he mentioned. The 70% where sepsis is occurring because of the factors that really relate to older age categories or relate to medical conditions that start to develop that pose a more significant risk for sepsis.
So we've gotten into some great details. So as my esteemed colleague Alex Hyatt would say, let's get down to some basic vocabulary here. So let's talk some of the basics. So what is sepsis and what causes it?
Yeah, that's a great place to start. So sepsis is your body's extreme response to an infection. So if somebody already has an infection that goes untreated for too long, it can cause sepsis. And really any infection can lead to sepsis, big or small, from a paper cut to pneumonia. And some of the most common infections are urinary tract infections or kidney infections, skin cuts, skin sores, or burns, lung infections such as pneumonia, gallbladder or liver infections, catheter and IV sites, and other bacterial infections like strep throat or viral infections like COVID-19 or the flu can all lead to sepsis.
And it's important to note as well that it could be the smallest cut or scrape. We've had the Stauntons on for a live stream last year talking about their son Rory Staunton and his tragic death from sepsis that happened from a very small site of infection. So can you just emphasize that, it really can run the gamut, right?
Absolutely. It can be anything from a small paper cut that goes untreated and gets infected to a continuous catheter site or an IV site that's an open port to your body. So it really is a range of infection sites.
And very often conditions like pneumonia, or Taylor, you spoke to the urinary tract infection, cellulitis. There are conditions that prompt a hospitalization, and generally it's going to be related to the onset of sepsis, which is really following that. Individuals, particularly older individuals that may have chronic obstructive lung disease, respiratory disease, or diabetes, where there is a proneness to leg ulcers, or if there's a sedentary nature of the person, and pressure sores can develop. all of those can really, really be prime sites. So again, those are all things to really watch. And ultimately, because of what Roger said, that it can be anything from something that appears innocuous, small cut, a bite, anything of that nature. It's where the vigilance is important is really on the signs and symptoms that can be identified early.
So that's a perfect segue, because I know early detection is important. We just really want to focus that attention on prevention, detection, awareness, vigilance, to piggyback on what Al said with that word. So can you kind of characterize, so what are some of the signs and symptoms, basic signs and symptoms of sepsis or potential for sepsis?
Some of the signs and symptoms to look out for and to be aware of are a higher heart rate or a low heart rate or a weak pulse, fever or shivering or feeling very cold, shortness of breath or difficulty breathing, confusion or disorientation, extreme pain or extreme discomfort or extreme fatigue, clammy or sweaty skin, general body swelling, and a mix of these symptoms, and it really is different for everybody.
That actually gets to one of my later questions, which, there's a lot of misunderstanding about this condition. There's a lot of what you just described that, although very extreme examples of it, could be, seen in other types of presentations of illness or chronic disease. So can you talk a little bit more about why is sepsis so misunderstood? How can we determine if it's sepsis versus something else that someone might have?
Well, in the early phases, the symptoms that might manifest can be easily confused with other symptoms. So, for example, one of the things that is often a trigger in sepsis detection in an older person is that the person has been found to have fallen, found to be confused. Very often the assumption is that, well, the person got dizzy, that, there was, that it might relate to their medication. But in actual fact, the person has become delirious from the onset of sepsis, perhaps associated with a urinary tract infection. And so again, it's important at that point not to try to diagnose, as a family member, or if it's yourself. What's really important at that point is to when reaching out to a healthcare provider, to indicate, this is what's just occurred to me. I'm concerned about sepsis. I'll give some other examples. Often there's a situation where the person is manifesting one of these symptoms, and there's just the cases are just too many to count, where the individual shows up to the provider, goes to the emergency room, seeks help, and it's perceived to be, well, it's you're having maybe you hurt your back walking or carrying something, maybe you're just exhausted, an issue like that, and what often happens then is that the person doesn't get better. They try to re-engage, and sometimes it's 2 and 3 times before that individual is ultimately identified with sepsis, and where treatment is commenced. Unfortunately, many times by that circumstance, the person is already many times in a free fall, where they're really on their way to septic shock, and that's very, very concerning. And there are things that New York has done, that we've done as an association with providers, to really try to intervene on that and help with that early identification. But again, what's very important is when there are symptoms that are observed, to not take those for granted, and to be proactive in saying, I'm concerned about sepsis.
That's great. And we'll delve a little bit deeper into some of those systemic responses to this the condition. We're going to take a quick break now. We're going to feature a short video about the Affordable Connectivity Program. Take a look.
Hi, my name is Greg Olson, and I'm the director of the New York State Office for Aging. Do you know what the ACP is? It's called the Affordable Connectivity Program. It's an FCC benefit program that helps ensure that households can afford the broadband they need for work, school, healthcare, and so much more. If you qualify for SNAP or HEAP, you qualify for this benefit automatically that will save you almost $400 per year. Eligible households can also receive a one-time discount of up to $100 to purchase a laptop, a desktop computer or tablet from participating providers if they contribute more than $10 and less than $50 towards the purchase price. The Affordable Connectivity Program is limited to 1 monthly service discount and 1 device discount per household. Please visit the website that you see listed below to see if you qualify for this really important benefit, and if you do, please sign up.
All right, we're back. I'm Roger Noyes, hosting today's live stream on the issue of sepsis with Al Cardillo and Taylor Perry from the Home Care Association. And I just want to maybe get some key takeaways. Let's make sure I got this right. So sepsis is response to infection. It can happen to anyone. It could occur from a very small cut up to a serious medical condition, underlying medical condition that can cause infection. It's potentially lethal. We talked about some of the data, and rapid diagnosis and treatment is necessary. And if you have any concerns that you might have sepsis based on some of the risk factors that we talked about earlier, talk to a practitioner, say, I am concerned about sepsis. So some of the statistics we've talked about a little bit, but it's really stunning, right? The prevalence of this condition and the fact that some few people know about it or understand it. So, but your organization has been working with Sepsis Alliance and End Sepsis, the legacy of Rory Staunton. Can you share some of the latest data, some of the latest findings? What have you been seeing?
Well, certainly, the concerns are that the mortality rates are very, very high. One of the real benefits associated with sepsis and preventive measures is that it's projected that up to 80%, perhaps more, of sepsis deaths can be prevented with early identification and entry into treatment, and that's really the key. One of the things that HCA has done, really as a leader not in New York State, but also nationally, is created a special assessment tool that our home care agencies, many of our home care agencies, utilize every time they visit a patient. And the tool helps identify what are the prime criteria that could be associated with sepsis, and then leads the nurse or the clinician who's with the patient into a series of follow-ups. Most important are education, but also critical follow-ups. In one of the studies that was done on the use of the tool, nearly 70% of those cases that were identified in that process were able to avoid a hospitalization because the home care agency had identified early and worked with the physician to help manage the case really right up front. And that's really very, very a very important element. You know, as far as the data goes, nationally, sepsis is as a Medicare expense is over $62 billion nationally. So it's far and away the most expensive procedure. You know, we've encouraged our colleagues here in New York, but also federally, if we want the healthcare system to be smarter and have better outcomes, let's invest more in early detection and prevention on sepsis.
And we're providing a lot of information here, a lot of data. Come back to our live stream after. We'll put some more information in the chat. There's a lot of great resources where Alex Hyatt from our communications team is putting some of this information on the screen as we're speaking. But there's a lot of great information out there. We just want to make sure that people are seeing it and are sharing it. Al and Taylor, you talked a little bit about the work that you're doing at the Home Care Association for home-based interventions through your provider system. Can you tell us a little bit about, I guess, the coordination between what you're doing in home care and maybe what hospitals are looking at, and why that's important too? There's got to be a kind of an all-sector response to this this phenomenon, this problem.
Yeah, that's a great question, Roger, and important to frame up. Roger talked previously about Rory Staunton and the Staunton Foundation. Kieran and Orla Staunton established this in legacy to Rory. Following Rory's passing from sepsis in April 1, 2012, and I think in particular the fact that he had several medical encounters when he wasn't feeling well after this cut, and none of them really led to the diagnosis that he was septic until it was really too late for Rory. One of the things that they did was work with the New York State government to create in New York hospitals protocols so that every hospital is required to have a sepsis protocol, so that when an individual comes into the hospital, they're examined for potential signs and symptoms, and then there's like a clinical process that gets followed for the timeliness of treatment. And generally, the treatment is antibiotics, IV fluids, and certainly other supports that an individual might need. The timing of that's very important, because for every hour that it's delayed, there's a 4 to 9% increase in the probability of death for that patient. So how does that relate to, again, back to Roger's question? So in the years that followed that, as we started to put together what we felt would be home care's role, we synchronized the protocols for what we ask home care agencies to do with what's done in hospitals. So this way, it's the same kind of criteria, it's the same kind of assessment, if you will, just at a different level through the home care clinician, so that when an individual is referred from home care to the hospital or to the doctor, and the communication is that we believe this person to be septic, they know that the same criteria is being used. At the same time, the criteria also matches criteria that EMS providers, so ambulance and rescue squads, would use. Having said all that, what's very important, however, is for the system to continue to work together so that there are not gaps in the process, so that there is a common language, so that the patient is educated. There have been some recent developments at the federal level with regard to hospitals that I think will make it more likely that home health agencies, hospitals, physicians, and others will work increasingly in common on this.
And I want to take that quickly back to the patient or the individual who might be experiencing this, right? Those potential gaps, or that coordination is really important from their perspective too. We talked about, I'm concerned about sepsis. As being a patient advocate, if you do have a concern about this, because there could be potential coordination issues, it's really important to advocate for yourself. So can you speak a little bit about that, just from the patient perspective, and how to make sure that you're communicating using the same language as you mentioned, Al, to make sure that that this is seen for what it is, right?
Yeah, so again, very, very important. So if you suspect symptoms and you're speaking to the doctor's office, again, it's important to say, well, I'm concerned about sepsis. But then it's also important that when you go there, you're not then waiting 3 or 4 hours before you're seen. Or if you engage EMS, so let's say someone has been confused, they've fallen, EMS has come, now they're going to transport the person to the ER. It's important that EMS, if they don't suspect it directly, hear from you or hear from a family member, we're really concerned, we suspect it could be sepsis. When the EMS would then communicate with the ER staff, we're bringing someone in, we suspect sepsis. Many hospitals have what's called a code sepsis, where they will respond, they're prepared to respond rapidly upon that information. Because what you don't want is for the person to show up in the emergency room, and then of course now there's trauma cases, there's other cases before them, for that person where sepsis is suspected to be waiting in the ER to be seen when actually they need immediate treatment.
So we've been talking a little bit about this condition being very misunderstood. Can you reflect a little bit on why that's the case? I'm just kind of curious, why is it that it's people don't understand this condition, they don't know what it is, they might confuse it with other conditions? Maybe reflect a little bit on that.
Well, one of the things that Sepsis Alliance and Sepsis have been really working to do in increasing basic awareness is to use the word. Many times people go into the hospital with an infection and they're discharged and have been treated for sepsis, but they're not necessarily told we treated you for sepsis because the primary condition was pneumonia or cellulitis or a urinary tract infection. So the word is not used enough, even in the nomenclature between practitioners or practitioners and patients. The other The other thing is that as advocates are really trying to get the word sepsis understood and the symptoms, much like a stroke or a heart attack. Like, what do I need to look for? I need to look out for arm numbness or droopy face, or heart attack, chest pain, or indigestion, things of that nature, is to make that as commonplace associated with sepsis. And Taylor went through all of those signs. We need to make that as commonplace there. The other thing is that it's very often, sepsis is very often confused with the infection itself, like MRSA or strep, or some other form of infection that the person has, when it's not really the infection. The infection is present, but it's the body's reaction to that infection. So it's sort of penetrating that in. And, much like other conditions, whether it's in school, whether it's in other areas of society, the focus, again, is on sort of the acuity of the conditions, and they're associated by name, and sepsis is just often not in the same conversation, even though its prevalence and its mortality rates are so high. As we said, it's the number one cause of death in hospitals. It's the number one cause of being readmitted to a hospital.
So earlier in the program, Taylor, you kind of talked about some of the signs and symptoms. Can we talk a little bit too about, for either guest, who's most at risk? We talked about older adults are among those most at risk, but we're concerned about everyone, right? Like, we want to get this information out to the world, really. So who's most at risk, and are there any other risk factors you can talk about?
Right. So as we touched on before, anybody can get sepsis. Anybody can have an infection that can lead to sepsis, but there are some people who are more at risk than others. So for adults who are age 65 and older, or children who are younger than 1 year old, are more at risk for developing sepsis. People with weakened immune systems, people with chronic medical conditions such as diabetes or lung diseases or cancer, kidney infections, people with catheters or IV ports that are constantly in their skin are more at risk. And those who have had a recent hospitalization with a severe illness, and also folks who have already had sepsis, are more at risk for reoccurring sepsis as well.
So the key takeaway is anyone's at risk, but if you have particular chronic conditions or some of the things that Taylor mentioned, really be vigilant and pay special attention. Just want to remind our viewers, we're talking about sepsis for Sepsis Awareness Month. Our guests are Al Cardillo and Taylor Perry from the Home Care Association of New York State. Sorry, I got a little tongue-tied there. We're going to take another quick break here for a moment, and we're going to, on November 3rd, we're holding our Older New Yorkers Day ceremony, which is celebrating older adults throughout New York State who are exemplars of volunteerism. One of our programs that really relies on volunteers, and volunteers are the lifeblood for, is our nutrition program. So take a look. All right, we're back. We're talking today about sepsis for Sepsis Awareness Month in September. Sepsis is the body's overwhelming response to infection. It's a very serious condition. We've talked about some of the data, some of the signs and symptoms, and some of the ways that you can advocate for yourself if you're concerned about sepsis. That's an important takeaway to remember. If you see some of those signs and symptoms, say, I am concerned about sepsis. We have our guests today, Al Cardillo and Taylor Perry from the Home Care Association. I'm Roger Noyes, the host of today's program. And before we get to potential guest questions from, audience questions, I wanted to just ask, is there anything that we didn't really hit upon that either one of you wants to stress that we haven't talked about yet today?
Well, Roger, thank you. You've really, I think you've really covered a lot. One of the things I guess to encourage your guests in is, folks might be thinking, well, geez, how can I get involved? What can I do as somebody who may care about an issue? Well, to quote individuals like Dr. Carl Flatley, whose daughter Erin died when she was 23 from a simple medical procedure that had an infection as a result of it, or Kieran Stoughton, again, who lost Rory. Things that they really emphasize is use the word. If you learn something about sepsis today, say something about it. One thing Greg would be telling right now, if he was on with us today, is that upon his work in sepsis, just simply mentioning it, having conversations about it, led others, even others within the agency, who ended up with either friend or familial or personal experiences. It basically led them to either early detection or referral to treatment when they otherwise would not have had any knowledge of it. And it goes back to the point that Roger said earlier, it's just not talked about enough. So one thing you can do very readily is to use the word and talk about it. Say to someone, I was in a conversation today and I learned something that I'm not sure I ever heard before, or learn some other dimensions to it. Another thing is if you go to the Sepsis Alliance website or the End Sepsis website, you will see ways that individuals can become involved. First of all, further education. Lots of resources on each of those sites, videos, articles, but also opportunities. Something just was circulated earlier today by Sepsis Alliance, inviting people to become part of the Sepsis Superhero Challenge. What things might you be able to do to contribute? Or there's also something called Sepsis Connects, which is like a broad consumer, connection point that you can engage in. So whether you know somebody that's had sepsis, or you've had sepsis, or you just simply want to do something to help save a life, check into those sites. I think they would be very informative and also have really an effect.
Yeah, and I think it's also important to note that sepsis deaths are preventable. So some infections can be prevented through vaccines, but also some basic infection control practices like hand washing and cleaning highly touched surfaces like doorknobs and countertops can help prevent infections as well. And once you do realize that you do have an infection and it is on the severe end and kind of moving past the basic infection into something that could possibly be sepsis, that it's really important to get help as soon as possible, because severe sepsis and septic shock are preventable, and it could save your life and save your limbs if you get help soon enough.
Taylor, I'm so glad you mentioned that, because I don't think we focused enough on that in the earlier discussion about some of the techniques that could really focus on prevention way in advance of even an infection happening, which is at the root cause of all this. So,
Roger,
yeah.
on that point, if I could mention that the Home Care Association is currently the recipient of a grant from the Mother Cabrini Health Foundation that is being currently, Taylor is the point person on this grant, and she is working to develop a module that we expect to be released within the next, let's say, a couple of months, that is geared toward helping to educate patients and families about infection prevention and control. And so these would be important practices that individuals that are receiving medical care in their home should know about. And we're looking to assimilate into this what are some of the best practices, best techniques, and best ways of supporting families in this venture. So we're very appreciative of the opportunity through this grant to help support the prevention process.
Well, that's wonderful work, and it really ties in with all the things you've been doing for such a long time on this issue. One thing I also wanted to highlight too, and you kind of mentioned this a little bit earlier, is just here's some of the stories, right? Watch our live stream from last year with the Stauntons. I mean, if you hear them tell their story about what happened to their son, it will it will illuminate it for you, right? This issue, and not only kind of provide a face to the issue, but really make it hit home. So I encourage people to pay attention to those kinds of stories and listen to people in the community as you're talking about this issue, that people that may have been affected by it, because there are a lot of people.
Roger, on that point, it's very interesting because the news is often filled with individuals that the way the press would present it, it'd be like that someone 24 years old in a rare condition just lost their limbs or lost their life, and very often, if you go into the article, what you'll see, but maybe it's one word mentioned near the end, is that person did that because of because of sepsis.
Right.
But those stories are important, and they're informative, because you can, when you look at the path that the individual had taken, in that, it's instructive for you and instructive for others as to things to perhaps either avoid or to make sure that you do. It's because it's either the quick wit at the time that is very important, or it's the lack of recognition, and then you see the story has a very different pathway.
Excellent, excellent. Well, we're going to open it up to some questions from our audience, and hopefully we have a couple that we can flash here. So looks like the first one here is, how can you tell the difference between sepsis and other similar conditions?
So, Roger, this was something that we spoke about a bit earlier. Is that one of the problems is it's sometimes very difficult to do so, especially in the early phase. The key way is the symptoms that Taylor described, or that you just saw on the time mnemonic that Roger just had on the screen. Those are very important, but really the key part of it is that if you may not even know that you have an infection, right? But if there's a condition that really follows any, like a sudden decline in somebody's mental status, or, for example, under the E, feeling like the worst pain that you've ever felt, like the worst discomfort, it's time to act. You don't wait for that. You might not know what it is, but at the same time, it's important to act on those kinds of symptoms. But I think the biggest challenge is that early phase is not easily distinguishable, and so that's the importance of the early recognition, the awareness, and the response.
Do we have any other questions? Okay, so this is an important one, right? Sepsis recurrence. So if I get sepsis once, will it happen again? I guess I would add on to that, is it more likely to happen again? I guess if you can.
Taylor, do you want to take that?
Yes, unfortunately, if you do have sepsis and you do survive from sepsis, you are more likely to have reoccurring sepsis. So it is something to look out for if you have chronic conditions, or if you were hospitalized with sepsis, that it is likely that it can happen again. But the good thing is, the symptoms, the awareness, and you can act fast and get to the hospital and get treatment as soon as possible.
And speaking to that point as well, we mentioned earlier that it's the number one cause of rehospitalizations. So, as a society, as a huge cost within the healthcare system is the expense of these rehospitalizations. So it's a cost to the system. It's obviously a very deleterious consequence to any individual that has to go back into the hospital. So knowing that of all the entire span of conditions, sepsis is the number one reason that people wind up back in the hospital, again, goes to the point of the awareness. But it also goes to the point of something Roger raised earlier about, well, how does the system work together? So it's really vital that on discharge, the hospital and the home health agency, or the hospital and the physician or the family, are all basically in a synchronized communication about the fact this is a person that your loved one or you as the patient, you've been treated for sepsis, and the likelihood of a recurrence is higher, especially in the early phase. So vigilance is important.
Excellent. I think we maybe have one more question. Oh, okay. Is sepsis contagious? That's an important one.
Taylor?
That's a great question. And sepsis is not contagious, but some of these infections are contagious. So the infections that lead to sepsis can be passed from person to person, and certain people have different abilities to fight infection in their bodies. So sepsis itself is not contagious, but the infections that lead to sepsis are contagious.
Well, I really want to thank Al and Taylor for this illuminating conversation about sepsis. It's so important. We do this every year for Sepsis Awareness Month, but of course we're providing information on this topic all the time on our social media channels. So I encourage everyone who's watching this either on Facebook or YouTube to please subscribe to those channels, and you'll find resources, additional information on this issue and so many other issues of relevance to older adults. So Al and Taylor, thank you so much for taking the time to be with us today.
Roger, thank you so much. And I just would like to just use the opportunity to really commend the State Office for Aging, itself, Greg, the entire office, because I can tell you that I'm quite confident that that in your aging director, that is the most advanced champion of sepsis in offices for aging in the country. I really, what you've done is extraordinary. I really also want to say that all the work that we do is really in dedication to individuals who have suffered losses from sepsis, and in legacy to those who have been lost. And we really are followers, if you will. The national leaders in this are the Sepsis Alliance, the End Sepsis Staunton Legacy. But we realize that as an organization who cares for so many people at risk, that we need to work and dedicate ourselves to doing everything we can in combating this illness. So thank you to our advocacy partners, especially in this.
No, it's absolutely critical. We're all in this together. We all need to be a show of force on this issue because of the challenges, about the complexity of it, and the fact that it's misunderstood, and so many other reasons. So I thank you so much for your advocacy and all the work that you're doing. Just want to do a little housekeeping to close out the show. So please like and subscribe to our social media channels on Facebook, Twitter, YouTube, all those places. And then next month for our next show with our director, Greg Olson, who I'm pinch hitting for today, the show is on October 26th at 1 p.m. We'll be talking with Intuition Robotics about our partnership to bring AI technology into the homes of older adults. Also on November 3rd, we're holding our annual Older New Yorkers Day, which is the greatest program that we produce, really, quite frankly. It recognizes older adults throughout New York State for their volunteerism, and the stories are great, and we'll be live streaming that on Facebook and YouTube as well. So save the date, November 3rd at 1 p.m. I want to thank our guests, and I also really specifically want to thank our show producer, Alex Hyatt, who's our Assistant Director of Communications, for putting on a spectacular show and really making things run smoothly behind the scenes. You really make it all happen. So thank you very much, and I look forward to seeing you all soon.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau. Please make sure to join us next time.